I'm Dendy, and I'm a clinical psychologist, and I've worked for the whole of my career as a psychologist in some form of eating or feeding area. So I've worked with eating disorders, and I've also worked with feeding problems. They're slightly different, and that's one of my strengths, is that I can actually help people to understand whether they've got a feeding problem or an eating disorder. I usually treat people with feeding problems and recommend that people with eating disorders move on to someone else who has more experience. I work with parenting a lot as well, because feeding, when you're feeding any age child, it's to do with your parenting skills as well. And parents can feel very undermined by the whole situation of not being apparently able to feed their children. There's a lot that goes on around food, in the interactions around meal times, what food means to people in different families and different cultures, and a lot of loss of self-esteem for parents, and I have to say especially mothers, who seem still to be the people who are mainly doing the feeding. I deal with feeding problems at different stages in children's lives, and one of the first and most important ones is weaning. This is very important, happens around the age of 6 months. Then we get to another stage around 1 year, where children want to do things for themselves and apparently start getting more fussy. Up to about the age of 2, this can be a real battle, and you can be in a battle with your child. Children start going off to nursery, they start going off to foundation year, and they have different problems with their feeding. They have problems feeding away from home. They then might bumble along for a bit and be moving into wanting to go on school trips, something like that, and feeling unconfident about what they're going to eat then and how they're going to eat it. Then it's moving to secondary school. Then it may also be something to do with being a boarder sometimes. Trying to eat school food 24/7 is not always easy. They might still have trouble with eating out in restaurants as they get older, eating with other people. They may start wanting to go out with girlfriends or boyfriends and are really worried about this area. And you can get to the stage where you're in the 6th form, you're planning to leave for university, and you've still got issues around food. And at all those stages, I can help and advise both the child, age appropriately, and their parents. And if necessary, I also advise schools and the place where they're learning or boarding. Well, I'm someone who loves my food, and I love cooking, and I have always stirred mud pies as a small child, fed my dolls chocolate drops cooked in an elastoplast tin on a radiator, stirred with a matchstick. I just couldn't keep my hands off the stuff. And one of the things that I like to do is try and convey some of the enjoyment of food to people who are very, very stuck and not enjoying their food at all and not enjoying feeding their child. So I just like to try and get some of that across, and some of the fun that can be had also in your relationship with your child, because this food thing can get in the way of having a nice time with your child. And I really think getting to know your child and having a good time with them is one of the most important things you can do, especially when they're little, but also when they're older. Parents contact me again and say it's going well. Or they contact me again and say, it went really well, we've reached another stage now that we need to discuss with you. So I regard my success as a good relationship with the parents, and when they get old enough, a good relationship with the children. And just them moving on and tackling things like going out for a pizza with their friends and just sending me an email and saying, I did it. And that's great. That makes me feel as though what I'm doing is really worthwhile.